We are on live now. We can start.
So, good evening to all present over here. I welcome you all to today's discussion, and I, Namrata Padgiri, shall be your host for today's session. So, here I am again with a session on community health with Anajari. So, before proceeding, I would like to brief you all a bit about Anajari. So, Anajari, in simple words, as the name suggests, it literally means the bond of love. Milind Datta is the founder of Anajori, and it is his love for his native land that brought him back from the USA to Assam in order to start this non-profitable organization that engages and promotes various initiatives such as striving for social change, loving leadership skills, and building entrepreneurship capabilities among the people living in Northeast India. So, for a couple of months now, we have been interacting with speakers from different regions via virtual media, and we have been trying to talk and discuss on topics that are very current and significant in today's generation. So here today we have our guest. His name is Mr. Ashish Pratim Borah. He is a mental health professional who has done his master's in clinical psychology and also master's in philosophy from MET University, Haryana. His area of interests are in childhood disorders, disability management, geriatric population, substance abuse disorders, and its management. And currently, he is a consultant clinical psychologist in Tejpur University. So we welcome you, sir.
Thank you,
Uh,
Namrata. Thank you,
I will.
Namrata. Thank you, Team Anajuri, for inviting me to conduct the session.
Yes, sir.
So, since the topic of today is anxiety disorders, like we've all known, and before we start, so I would like to clarify what exactly disorder is. So, whenever anxiety, we've all heard, right? But anxiety, we've been hearing because people complain about anxiety, depression, right, left, center disease. The thing is, when does it become a disorder? Firstly, when it only becomes a disorder when it hampers with our daily living, first point, and then the problems are so severe because when we talk about anxiety disorder in general, there has to have physical symptoms of anxiety. I'll get to that, but then there will be thought aspect also, like worry, apprehension, and everything. Irritability has to be there. But then when do we call it a disorder? When it is crippling with our daily life activities, it is hampering us so much that we cannot function properly. So that is when we call a disorder. Because when we talk about stigma related to mental health, it is there. Well, like you all know. And then something happens, people feel very anxious because a certain level of nervousness or nervousness is there. But then we've not been using the correct terms these days. Or probably somebody has a small problem, they feel that they are depressed, which might not be true. So it is like that. So when we talk about anxiety disorder in general, anxiety disorder in general is a very broad term. Under anxiety disorder, there are different types of disorders which can be subdivided again. Firstly, there is generalized anxiety disorder, panic disorder, followed by specific phobias. Agoraphobia is one. Then social fear of social situations is one. So when we talk about, we will get to the types of anxiety disorders later on. Now let's discuss on what happens when we develop anxiety disorder. How do we develop anxiety disorders? First and foremost, when we as psychologists or probably in general, in order for us to develop a disorder, it always has to have a biopsychosocial approach. I know the word sounds fancy, but then it has the biological aspect, the sociological aspect, and the psychological aspect of things. When we talk about biologically it has to be genetic, right? So if anybody in the family has anxiety disorder or any other mental health issue, that can be passed on to the offsprings or probably siblings, followed by the sociological approach, the environment, the harsh environment, the individual is in trauma or whatever. Psychological would be the reaction to these things. So basically, we see the biopsychosocial approach of how anxiety disorders occur in an individual. So there can be a number of ways, or probably there are multiple factors through which an individual can develop these disorders. Firstly, during childhood, the child did not have a good upbringing, probably had a traumatic upbringing, was was sexually abused as a child, or probably parenting was very tough, was through had to undergo his or her childhood in very adverse conditions, or probably a lot of factors were involved, or probably while growing up there was a bit of gender dysphoria which was there, and then later on developed into anxiety disorders. So we cannot, there is not just one factor which leads to anxiety, there are multiple factors at play here. All right. So, and then when we further subdivide, or probably suppose let's just say how the model of anxiety or negative thought works. Because in psychology or probably whatever, see, if you, I'm pretty sure you guys also are also aware of the amount of information which is there in social media and the access to knowledge you guys have right now, is it is not just about the physical symptoms of anxiety. There are a lot of intrusive thoughts which are at play here, or probably a lot of negative thoughts which are at play here, because it is all interconnected. So there are thoughts which lead to certain feelings, suppose fear and apprehension or worry, followed by feelings that generate certain kind of behavior. Suppose whatever makes us feel scared or anxious, we try to avoid that situation. We try to run away from it. Or probably we try to use negative coping strategies to get away or get past that anxiety, right? And then followed by behavior which interferes with our thoughts. So the cycle is a vicious cycle which goes on and on. Suppose let's get back to the early childhood. How does anxiety in an individual develop? Probably. Suppose learning experience would be one. Suppose learning in during a childhood. Suppose an individual has a specific fear towards dogs, excessive fear towards dogs. When the individual was a child, was very young, the dog started barking at him very badly, very aggressively. When children are usually young, probably toddlers, what happens is we get very scared and then we want the comfort of our parents, right? So that was his learning experience, that you should not go near dogs, they bite. And then parents also reinforce that behavior, saying that don't go near a stray dog that might bite you, or probably be careful while you go near a dog, or don't go near a dog, they bite. So that was the schema which had been developed in the individual's head, right? Not all dogs are dangerous, or not all dogs would come and attack you. In general, that is what you know or I know. But what happened was the child had formed that image, or probably that schema in the head, thinking that I should stay away from dogs, irrespective of shape, size, color, or whatever breed it is, right? So the individual had a generalized schema regarding dogs. Dogs are vicious, dogs are dangerous, dogs attack. Correct. So what happens is the individual grows up, he was walking on the street. There will be dogs in India. We have cows and dogs everywhere on the street, right? So that's a common scenario in India which happens. So that individual had a close encounter with a dog. So that schema got activated that I should be stay away from dogs. And then those negative automatic thoughts develop. I should not be able to step out of my house because what if a dog starts to bite me? What if something happens? So that has a loop. The person starts feeling anxious, thinking of going outside. Probably breathes heavily, difficulty in breathing, palpitation is there, feels dizzy when he wants to go outside, or probably has a behavioral response. I will go inside, I'll stay inside the house, or probably I'll try to run as fast as possible. So those things are self-feeding in terms of specific phobias or specific anxieties. When we talk about generalized anxiety disorder, so what happens is generalized anxiety disorder, we it is the worry in the generalized anxiety disorder is free floating. Suppose I am having generalized anxiety, I will worry about, suppose I had a session and we had a technical glitch. I suppose if I have anxiety disorder, so I will think in a certain pattern. So, oh my God, what happened? Is my connection okay? What happens if the connection breaks in between? Excessive worry. Or suppose I think they did not like me, that's why they're not starting the session on time. That is what usually people think. Those are negative biases which happen, but then in reality, these are not true. So in generalized anxiety, it is free floating. Suppose what will happen if my data pack runs out during the session? I will make a fool out of myself and then I start feeling anxious. So those are certain types of anxiety. So, and when we talk about panic attacks would be all of a sudden one full-fledged blow of anxiety. suppose in case of phobias or in case of generalized anxiety, your anxiety slowly builds up. But then in case of a panic attack, what happens is your anxiety comes out abruptly, all of a sudden. So when we talk about anxiety, the first and foremost symptom is irritability. The psychological symptoms will be irritability. You are very fearful of things. You are sensitive to noise, and then you worry a lot. You cannot focus on things. You feel restless. You feel like crying. So those are certain common symptoms of anxiety. Okay, I know we all feel anxious, but then the thing is, this has to have a certain degree of difficulty in your life. Suppose if you so I'm not saying Namrata that you have anxiety, but then I'll just say suppose if an individual is going through generalized anxiety or any kind of anxiety disorder in general, you would find it very difficult to sit through the session. You'll feel very overwhelmed. You'll have a lot of fatigue mentally. And then in case of physical symptoms, I'm pretty sure everybody has noticed this. You have dry mouth tendency whenever you're stressed or probably you want to do something, you're panicking. So that is one sign of anxiety, physical side. Followed by you have a lot of gas buildup, acidity in your abdomen region, probably, and then you have a lot of palpitation. You feel that your heartbeat is running so fast it will not stop. You'll probably die of a heart attack. Followed by you have a lot of discomfort. You feel you have hot and cold flushes. You feel very hot at times, or probably you feel very cold at times. You feel this tingling in your body, or probably you can hear a humming sensation, or probably a buzzing, ringing sensation in your ears. Followed by you feel dizzy, you feel nauseous at times, and then you have a tendency. Suppose since you have a dry mouth, I'll tell you the reason behind it. Okay, certain symptoms say that there's a tendency to go to the loo very often. Frequent urination is common. Just because the individual has a dry mouth because of anxiety, the person keeps on drinking a lot of water, and then the person goes to the loo because of that. So it's a cycle. Then people misinterpret that. Because people are not mindful of the fact that it is related. And you have insomnia, you have night tremors, and then what happens is you don't feel like eating, you don't feel like hungry. So those are certain symptoms of physical symptoms of anxiety. So now the problem is because post-COVID, the occurrence of disorders have changed. Because I am somebody who's working in a setup where I am dealing with the age group of 18 to 20, 24, 25-year-olds. Because I'm seeing that the anxiety disorder is constantly on a rise. And then people are also not labeling or probably mislabeling the word anxiety. Because when I say mislabeling it, people just think when I talk about anxiety, people just read the textbook symptoms. Whenever the person is feeling very overwhelmed, the person feels that whenever I am having anxiety, I'll feel restless, I'll feel breathless, or probably I'll shake. But then that's not it. On the contrary, what would happen is a person having an anxiety attack, a person having chronic anxiety disorder, the person might just feel like sitting in the room and crying and get bothered by all the thoughts. So that is one aspect of anxiety which nobody talks about. Because when we stick to Instagram reels or probably any content creator these days who's not even a certified mental health professional, they would give you a lot of information, but then it depends on you or probably what to choose. Because I know that little knowledge is dangerous. I feel too much knowledge is also dangerous at times because you would not know how to segregate it properly these days. Because you should always consult. Suppose you should always consult an individual who knows actually properly, because there will be a lot of information. Suppose people talk about workouts, people talk about faith healing, spiritual healing. I know those has its impact, but then how reliable is the source? That is my question. And what happens is since we get this information very easily, we've started self-diagnosing ourselves. We've started self-diagnosing ourselves. Anything and everything happens, we try to put ourselves there and then think that this is there, right? Without actually knowing the problem. So in order for a disorder to become chronic, it usually has to take 3 to 6 months. We don't understand that. Now, see, I'm in a setup where I deal with students actively. People, definitely there's a misconception. Firstly, there's a lot of stigma associated with mental health. People don't like to come out with these stigmas. Secondly, when they decide to come out, they have a lot of misconception toward the disorder. They feel that they have a fight or probably some things are not right, they already feel it's depression or anxiety. It can be something late, something different also. Because in anxiety, in mental health or probably in clinical psychology, psychiatry, those are not just two disorders which are prevalent in individuals. Those are very common disorders. ক'বলৈ গ'লে anxiety হলে ডিপ্ৰেছনৰ ফিচাৰ্ছ কিছুমান থাকে মানে কোমৰবিড বুলি কয় চাহ আৰু বিস্কুট যেনেকুৱা আমি যে কওঁ যে তেনেকুৱা মানে বস্তুটো anxiety হলে অলপ ডিপ্ৰেছিভ থটছ কিছুমান আহে বা ডিপ্ৰেছিভ থটছ থাকিলে অলপ anxiety কেতিয়াবা হয় they go hand in hand so that is why there is another disorder called mixed anxiety and depressive disorder whenever the person gets a diagnosis when we diagnose an individual with mixed anxiety or depressive disorder when যেতিয়া ডিপ্ৰেছনৰ symptom বিলাক ইমান সিভিয়াৰ নহয় যে ডিপ্ৰেছিভ এপিসোডৰ ডায়াগনোসিসটা পাবো বা এংজাইটি সিম্পটম কিনি ইমান সিভিয়াৰ নহয় যে পিওর এংজাইটি ডিসঅর্ডার ডায়াগনোসিসটা দিব লাগিব it is a mix of both the things so it works like that now let's come to the treatment aspect or probably how do we get better from these techniques ঠিক আছে আমি বেমাৰৰ কথাটো বহুত পাতিলো বেমাৰৰ কথা পাতিবলে আৰু আমি ইন ডেপথ যাব লাগিব কিন্তু কথাটো হ'ল যে now let's talk about the treatment aspect of it yes it is one of the biggest problems still there because our coping strategy has become different we are trying to cope negatively about it see the thing is anxiety or any other psychological disorder can occur due to different factors in our life have you heard about I'm pretty sure everybody in the team has heard about substance abuse as a rising factor but then why is I feel substance abuse is not just the problem we are looking at. It is a negative coping mechanism because of anxiety or depression. The person is trying to get better. If you understand what I'm trying to tell you, people across every community these days, any or every community, you see people are trying to hide their problems over substances, drinking a lot, taking, and trying to temporarily fix them. So whenever a person, you see a person detaching himself or probably getting too much into substance, feeling easily irritable. So what you do is that's a red flag you need to identify as individuals. I'm not saying that everybody is a professional, but then in case of friends, family, colleagues, you need to identify if something is off about the individual. And it's not that there are suicidal tendencies prevalent only in depression. Suicidal tendencies are very much prevalent in anxiety disorders also. The person feels so overwhelmed with those thoughts and whatever the person is feeling, the person feels like ending his or her life as well. So that is very common. We should not just make the common mistake of depression because there's a common notion, right? People who are depressed end up killing themselves. That's a very generalized statement which people give, right? So it is not just true in case of depression, it is there in case of anxiety as well. So coming back to the treatment aspect, first and foremost, whenever you have problems, you should always seek help from individuals. Suppose I know, let's talk about Assam in general. Our society got a problem to ki even though our gharat jodi ko bole amar hator bemar hoise skinner bemar hoise but the problem hoise our parents will be happy to take us to a doctor but then when we talk about mo mon to beya lagi thake mo bhoy khabata hai they will take a back step in taking us to a psychiatrist or a psychologist or a counselor. They would rather take us to the temple, take us to the bench, take us to the oja, or probably take us to the nearest astrologer. And then we have to constantly push them. And then later on, when things go out of hand, then they decide to consult a counselor, therapist, or a psychiatrist. So because of the attitude, also there's a lot of problems prevalent. So that is why a lot of children are scared to talk to their parents regarding these things, which is very common these days because because they think that their things are not validated because issues like mental health related problems are not non-existent in our society. They feel it's a taboo to discuss in a way, and a lot of people are ashamed of the fact that I am consulting a psychiatrist, a psychologist, or a counselor. They feel that people will laugh at us. It is not like that. It is a temporary phase or probably a phase which will last for a certain time period where you're at your lowest point, and then you'll eventually, with proper therapy, with proper guidance, with proper treatment, proper medication, you'll be able to redeem yourself. And how do we do that? Firstly, whenever we feel that your worry and anxiety is going off the roof, and you notice that it is difficult for you for a certain time period, firstly talk to a friend who understands, because we don't need a person who tells us "To besi bhabi thako, সেইকাৰণে এনেকুৱা হয়." We don't want that answer, right? Because বেছি ভাবি থাকিলে হোৱা প্ৰব্লেমটো সেইটো নহয় বাৰু, তাৰ মানে ভাবি ভাবি ব্ৰেইনটো ইমানে টায়াৰ্ড হৈ গৈছে আৰু বাকী প্ৰব্লেম হৈছে মানে কৰিব কি, we don't want that answer. Suppose যদি ফ্ৰেণ্ডক কৈ হেল্প হোৱা নাই, firstly we should write it down, whatever you're feeling. Whenever you're feeling overwhelmed with your feelings, try journaling it out. Journal এখনত বনাই গোটেইখিনি বস্তু লিখিব লাগে. Followed by, there are different relaxation techniques. Because আমি কওঁ relaxation technique কিয় আমাক help কৰে physical symptom খিনি বা মানে বাহিৰ ওলাবলৈ, our brain and body or probably our physical system as an individual, তোমাৰ হওক মোৰ হওক যিকোনো, males females not a difference, our body and brain is hardwired in such a way, এনেকে আমাৰ wiring হৈছে মানে physically wiring এনেকে হৈছে, যদি আমি এইটো সময়ত ৰিলেক্স হৈ আছো নহয়, আমি পটককে এংজাইটি বিল্ড আপ হওঁতে সময় লাগে, বা যদি এংশিয়াছ হৈ আছো আমাৰ লাহে লাহে বস্তুটো বিল্ড আপ হ'বলৈ সময় মানে তোমাৰ এংশিয়াছ ষ্টেটৰ পৰা ৰিলেক্স ষ্টেটলৈ আহিবলৈও সময় লাগে তাৰমানে, ঠিক আছে? সো আমি যদি ৰিলেক্সেশ্যন টেকনিক প্ৰেক্টিছ কৰো সদায় এভৰিডে আমি যদি প্ৰেক্টিছ কৰো, তেতিয়া লাহে লাহে আমাৰ মানে সেই এংশিয়াছ ষ্টেটটো মানে ডিলে হৈ গৈ থাকে, পটককে আমি এংশিয়াছ নহওঁ তাৰমানে, সেই বস্তুটো ইম্পৰ্টেণ্ট হয়। Followed by, at least everybody should indulge in 30 to 45 minutes of physical exercise every day. It's not about how we look or probably society's version of the ideal body type. I'm not getting into the debate of body positive or whatever. But then working out is important, or probably any sort of physical activity is important for a scientific reason. So what happens is, our ব্ৰেইনত বহুতখিনি কেমিকেলছ কিছুমান থাকে, ষ্ট্ৰেছ বেছি হয় কৰ্টিসল লেভেলটো বাঢ়ি যায়, কৰ্টিসল লেভেল বঢ়াৰ লগে লগে আমাৰ বডিত যিটো বাঢ়ি গৈ থাকিলে that can lead to anxiety in general. যেতিয়া আমি ৱৰ্কআউট কৰিম বা এক্সাৰচাইজ কৰিম বা আমি যিকোনো ফিজিকেল এক্টিভিটি কৰিম which actually helps us get tired or probably whatever it is, it reduces the level of cortisol in our body, it reduces the stress, it reduces the level of anxiety in our body. So that is why working out is important, and not because of how you look. Nobody cares if you are overweight, underweight, but then this is important to reduce the level of stress or probably the level of cortisol in your body. Followed by, after that is done, after you deal with your physical symptoms, the most important aspect, the thought process, the intrusive thoughts, the negative automatic thoughts which are at play here, which can be the difficult part to deal with. In those cases, there are certain techniques which your counselor or therapist would be able to help you. যেতিয়া আমাৰ প্ৰবলেমখিনি বেছি হয়, তো ট্ৰিটমেণ্ট হেজ টু বি টু ফল্ড। আমি সাইকিয়াট্ৰিষ্টৰ পৰা মেডিচিন ল'ব লাগিব যাতে আমাৰ চিম্পটমছখিনি কমি আহি থাকে, আৰু থেৰাপি বা কাউন্সেলিঙতো যাব লাগিব so that we can manage our negative thoughts or probably manage our anxiety from coming back. So it is a two-way process. So that is why it's very important. So that is in general a summary of anxiety disorders. If it would have been a longer discussion, we would have incorporated a lot of things. If anybody has any questions regarding that, I'll be happy to address.
Sir, I do have one question.
Sure, please do.
I have one friend of mine, and I know very well that she's also suffering from these anxiety disorders, because she kind of repeats the same problem again and again. And then when I try to help her with some suggestions, she doesn't take it easily. Like, suppose if I say that just chill because time heals. So she replies that time doesn't heal. We just know to live with it. She replies with that. So, sir, is that possible? Like, how does a person behave having anxiety disorders over time? Like, do they learn to accept it and go with it without healing?
See, the thing is, there's a different way of how you accept and work towards it. The thing is, a lot, like I said, there is positive and negative coping. Give me one example, Namrata. Our anxiety hole youngsters, what is the one behavior which is fairly common? Look, example, I know this is a common example. Everybody does that. Majorly, 95% will do that. When people have anxiety, what is the first thing they do?
So first thing is that they will never approach someone or even if they approach, then it's very rare that they approach. This is the thing, and they
Good.
keep this
So yes,
thing
the
with.
first thing which youngsters would do is, or probably anybody, not youngsters, any across a major age groups. Suppose I am in my late 20s, or probably people in their 20s, or probably in their 30s. If they're smokers, the first thing when they feel anxious, they'll take out a cigarette from the packet, start smoking. That makes you more anxious at the end of the day. That is one common behavior which is there. People feel that cigarette খাইলে anxiety কমে যাব, but then at the end of the day, anxiety আমার সেইটো সময়ত যদি anxiety হৈ থাকে cigarette খাওঁ, আমাৰ anxiety বাঢ়িহে যায়, মানে নকমে কেতিয়াও। পিছত আৰু এনেকুৱা হয়, ফ্ৰেণ্ডছে বহুত এডভাইচ কিছুমান দিয়ে যে মদ খাওঁ, কিবা কৰোঁ, নেগেটিভ কপিঙৰ ষ্ট্ৰেটেজি বহুত আছে। Suppose a person is feeling overwhelmed and anxious because of a breakup. What are the two negative suggestions which a friend can give? Be it a girl, be it a boy.
So
Namrata, you're on mute, I think. You're on mute. I cannot hear you. Namrata, you're on mute. I cannot hear you. Yeah. Yeah, Namrata, continue. You were on mute. That's why I could not hear you.
okay. Sir, I say that the friend will give the same suggestion that you should move on, and then if we are not able to move on, then they will suggest us with drinking stuffs and all, smoking. This is the most common I face.
After that, beleg lora pabi, beleg swali bahut pabi. Ye the dating app. Those are very, see, that works when if it works for you, it's well and good. I am not trying to comment on anybody's personal choice, but then the thing is, যদি সেই বস্তুটো দি হেল্প হোৱা হলে তেনেহলে কাম নাছিলে, বিকজ এইবিলাক শৰ্ট লিভড হয়, মানে এইটো মানে বস্তুটো টেম্পৰেৰী ফিক্স, মানে আমি সেই বস্তুটো ডিলে কৰি দিলো, আমি এড্ৰেছ নকৰিলো। এণ্ড it's possible to live with anxiety. It's possible to live with anxiety provided what you do is you acknowledge your problem, accept your problems, you become mindful that these trigger your anxiety, you know how to manage well. And see, the thing is, anxiety suffer কৰি থকা মানুহেতো বহুত বছৰ suffer কৰে, 1.5 বছৰ 2 বছৰ 3 বছৰ suffer কৰে, কিন্তু আমাৰ প্ৰবলেমটো কি, we want a quick relief from anxiety. আমাৰ সব the thing is, আমি যেতিয়া ক্লায়েন্টছ বোৰ চাই থাকো, কেতিয়াবা এনেকুৱা লাগে they want a quick fix, দৰৱ খাইছো কিয় ভাল হোৱা নাই। I'll give you this heads up, therapy also takes time. ঠিক আছে, therapy with minimum of 5-10 sessions, so you would need a therapy to at least get to the bottom of the problem where anxiety is started from. প্ৰথম সেশনত খুব ভাল লাগে, your issues are addressed, more anxiety can be control কৰিব পাৰি। And therapy is not always a joyride, it is a roller coaster. You'll make certain discoveries. Sometimes you might feel very overwhelmed, sometimes you might feel very happy, sometimes you feel you're stuck, sometimes you feel that you're making progress. So ইয়াত কোনো guarantee দিব নোৱাৰে। With medication also, anti-anxiety medication also, the medication also takes minimum 15 to 20 days to work. ঠিক আছে, কাম দিবলে চোৱা, in terms of psychiatry, if I tell you, আমাৰ ব্ৰেইনত কিছুমান ৰিসেপ্টৰছ আছে বা বেলেগ বেলেগ কেমিকেল সিক্ৰেট কৰা জায়গা আছে। আমাৰ প্ৰবলেমটো কি হৈছে, কাৰণ আমাৰ ব্ৰেইন কেমিষ্ট্ৰি, যোনটো নিউৰো কেমিষ্ট্ৰি আছে, সেইটো ইমবেলেন্স এটা হৈছে। আমি সেই ইমবেলেন্সটোকে বেলেন্স কৰিবলৈ গৈ আছো, তাৰ কাৰণে দৰৱটো খাই আছো, ইকুৱেশ্যন আমি বেলেন্স কৰিবলৈ গৈ আছো। সেই বেলেন্সটো হওঁতেতো সময় লাগিব, কাৰণ ইমবেলেন্সটো লাহে লাহে উইথ ডিউ কোৰ্স অফ টাইম বাঢ়ি বাঢ়ি আহি আছে। তো সেই বস্তুটো কমোতেতো সময় লাগিব ন, সেই বস্তুটো আমাৰ মানে আমাৰ ধৈৰ্য নোহোৱা হৈ গৈছে। মানে we want the quick relief, so that is why people get into substance abuse and people feel suicidal a lot. Instead of working on it, people feel like যে এনেকে জীয়াই থাকাতকে মৰি যোৱাই ভাল, মানে এইবিলাক those are statements which usually occur. And people don't like to talk openly about mental health issues. People are very shy, they like to brush it under the carpet. People will do great things, but then how many of the people would say that yes, I had anxiety, I took medication for it, now I am better off. In a party, if you're sitting with your age, people of your age group, probably I'm sitting in a party with my age group of people, how many people will address their problems? Everybody will highlight their successes. Somebody got a job in some place, somebody cracked IIM, somebody cracked IIT, somebody got a job offer, something happened, somebody's in a relationship with this, that, everything. But then people will not address about these issues. People feel that they'll be judged in a bad way. So that attitude needs to change from our society today. Any more questions? And in case of your friend, I think please ask her to seek help, because the more she denies about it, it will be difficult for her to process her things later on. And it can develop, it can lead to other disorders later on. No? So that is it.
So it's not like she is totally unaware of these facts, like what she should do. She should visit a psychiatrist. This is one thing, but then she already knows what to do, but then she doesn't go with that. This is her.
But then it's very difficult for her. Initially, he pushed to people are बहुत determined. For a lot of people, some of us mutat student ahi, so those student egoraky decide কৰিছে বা এজনে decide কৰিছে যে মোৰ ওচৰত the month of July আহিব ঠিক আছে আহি পেলাই মোৰ অফিসৰ পৰা ঘূৰি গুছি যায় ৱেটিং এৰিয়াত বহি থাকি উঠি গুছি যায় মানে এই worryটো থাকে excessive worry থাকে গলে কি হ'ব কি নহব তাৰমানে এইটো লৈ anxiety এটা থাকে জুলাইত আহিব লগা মানুহ সেপ্টেম্বৰ নৱেম্বৰত আহি ওলাইছে মোক ক'ব মই ইমান দিন আহি ট্ৰাই কৰিলো গোটে ঘূৰি গুছি গ'ল প্ৰবলেমটো কি জানা নাই এই প্ৰথম সেশনটো আৰম্ভ কৰা এন্ড তুমি যেতিয়া নিজে ভাবিবা যে মই আজি ট্ৰিটমেন্টৰ কাৰণে যাম হয়তো লাগিবই ভয় লাগিব প্ৰবলেম হ'ব but then when you decide যে আজি মই সেশনটো ষ্টাৰ্ট কৰিম at least 5% of your problems get addressed. I'm not saying solved. At least 5% problem to address hobo. But the fight is against ourselves. No, we're not fighting against anybody. We're fighting against ourselves, our thoughts, our inner feelings. That is what. Or one example I give my clients a lot of times. Problem to jeta amar bhitor pa ulai aise answer to tar bhitor pa ulai. And mind you, always people think that we will give tailor-made solutions. No, we will not do that. We will help you maneuver through your problems in a proper way. Ask clinical psychologists, we will help you maneuver through your problems. We'll maneuver in such a way that you can find your solutions to your problems. We will not give you solutions. You come to us, you pay, we give you solution. Anxiety, valuable, depression, valuable, but not valuable. That is not what we do. That is not our paradigm. So that is also important. Anything else?
No, sir. This shall be the questions from my side.
Okay.
So as we are already running out of time, so we would like to end this discussion here only. And sir, it was much honor to have you among us today, among this discussion.
The honor is mine to be a part, and I could not give you the proper time because of technical issues.
Sorry, it was
we'll connect next time with a proper session on different topics.
Apologies again, sir, that we were not able.
We technically understand. See, when we have digital platforms, we are bound to have problems. So in last 3 years, we've all understood. So with the technical glitches of as therapists, we also have difficulties in our online sessions because of internet connectivity or the platform. It's okay, completely fine. Thank you so much, Team Anajuri, for having me. It was a pleasure. Thank you.
Thank you, sir. We will have more such sessions.
Sure. Please. Bye.
Thank you.
Bye.